I will turn it over to Rene Toolson, who will take us into our contracts conversation.
And Anna, if you could share my picture right now, that would be super helpful. I pulled a fast one on Anna in the middle of, oh yeah, there it is. So, so you could you even click on it so you don't have to look at the screen. But so every day I have a crazy dog, and she's part Australian Shepherd, so I have to take her on a walk before I can even consider doing anything for myself other than maybe having a glass of water, just to help. That helps all of our days go better. And as I was walking this morning, I was thinking about that I have 55 minutes of this Zoom workshop, if you want to call that today, focusing on topics that I appreciate are highly important to all of you, and yet not the prettiest and most flowery of topics. And as I was thinking about that, and I thought, I guess the first thing I wanted to do, which I didn't do, was pause and just have everybody take a deep breath as we switch gears and refocus. And what I was thinking of focusing first on was just this tree. This tree is in my front yard. It's a what's called a horse chestnut tree. It is actual beautiful moment right now. It has seasons, as we all know, as we all have in our lives. This tree has seasons where it looks awesome right now today, and then other times where it looks like one of those wicked witch trees, which is, it's bare and scary looking, and other times when it's covered in leaves. Anyway, I was thinking about the tree as we were walking, and you know, thinking about what we're focusing on right now. What you see right now on this tree, there's a beautiful flowers on the tree and really lush, huge leaves. And what's behind the tree is kind of a gnarly, sturdy, scary trunk. It's super thick, super resilient, and super, it's just, I can't explain it. A lot of the branches in the tree trunk are the size of trees. It's a very old tree. And while I was walking, I was thinking about the field, our field, and I think of all of you as those leaves and flowers. You're beautiful, and I've been blown away by that beauty, I think, over the last 2 months, by what you've all been doing out in the field in terms of just flowering in a face of great challenge. And this section of the workshop is really focusing on the trunk. It's on the meaty, beefy stuff in the background that we don't want to look at or we don't want to see. And it's not the most fun part. But we know that trunk is important too. And so I'm not trying to defend it. I'm just saying I recognize that the next hour is going to be focusing not on that beautiful flowery leaves and the tree, the part of the field that I think glows. But I wanted to acknowledge that, and then launch into kind of the trunk. We're going to focus on the trunk for a while. And I think a lot of the elements of the presentation are going to be on some of those things that you were interested in. So we can go back to the slides, Anna, for a second. Take a deep breath again. Thank you, Anna, for being so flexible. The other thing I wanted to say at the beginning of this, and I think you'll hear this throughout, you're hearing it already, hopefully you'll get tired of hearing it, is how proud I feel to be associated with such a resilient and creative group of people who demonstrate compassion so evidently all the time. I feel so privileged to be working in this field right now. And so if we could go to the slides, awesome. This is kind of this is the outline of what I'll talk about today. Hopefully I won't go super fast, although in my nervousness and I might. We're going to talk a lot about what's going on right now, this current year, the SFY State Fiscal Year 2020. Then we're going to go forward and think about what's happening next year. Where we think we're going with contracts and expectations. And then we want to spend some time talking about performance-based contracting and partly look at this year, because part of my goal was, as we went through performance-based contracting this year, was to use this year as a time of reflection, not to just keep charging ahead, but to learn from our experiences and then talk about where we're going. So you can go to the next slide. Certainly, the COVID-19 pandemic has an impact on all of these areas. So next slide is, so State Fiscal Year 2020, we're going to focus a little bit right now on where we go with spending and budgets right now. Any changes adjustments we're making to some definitions and data collection, or not really, and then we wanted to talk a little bit about our office hours. So that's where I wanted to go next. We can go to the next slide. So that's just where this first section. So first for spending, and I think we've talked about this a lot, but we're not, unfortunately, even though I know that there's a huge fiscal impact on all of you, we're not allowed to carry budget spending from one fiscal year to the next. And that really relates to our spending authority. And so the legislature gives our department certain spending authority in certain budget categories, and home visiting has spending authority even of our federal grants. And so we're not able to do any carryover. So, so if we think about that, when we look at this next, everything has to be spent down in your current contract by June 30th. So your last invoice, which is due at the end of July, has to reflect spending. It's all the spending that you can do for the year. So the bulk of what I wanted to talk about in this slide was really thinking about your current budget and how you're currently spending. What we cannot do is do any shifting within our budgets across fund sources. So if you have funding in McV and funding in general state fund, those totals are set and there's no movement across those totals. But what we are allowing for is movement within those totals, and lots of flexibility. We're working to not even have to run amendments for that flexibility, but I would say look at how you're spending right now. Look at how you've allocated costs over the last year. If you anticipate a lot of underspend because you've had some personnel losses or shifts or reallocations, I know for a fact that almost all of you are not fully billing the HVSA for your costs. I know a lot of you aren't charging for indirect, for example. And this is the time to rethink that. And we're open to having, I'm seeing basically invoice corrections. You don't have to do a new invoice. You could just start looking at, could we look back and say, I haven't charged rent for my program all year, and this is a time to do that. So what I would encourage you to do is think backwards and make sure that we've covered all of your costs over the course of the year. And that might be your fiscal person has to do that. And also be thinking about, what is it costing your program to be delivering these services virtually? And if you have some funds available, could you potentially amplify your expenses around supplies to focus on more remote kind of capabilities? So that could be technical, it could be your computer, laptop, notebooks, that kind of thing. Is there anything right now that you can spend on that will help you deliver those services right now, that you could then carry those supplies forward into the next year if you were to make those purchases now? But so that's where I would encourage you to be looking at your budgets right now to figure out how you can be as whole as possible and make sure that we're covering as much of your expenses as possible, knowing that we can't carry forward the dollars from this year. But any major shifts, and I think you'll still need to run them by your program specialist. So I'd say be in constant communication and be constantly talking to them and asking questions if you have any questions. And they'll work with you to make sure that everything that we can work to make as much as possible allowable, and we can make sure that we can reimburse you on all of those expenses. So I'd say if you're going to deviate from your budget by more than 10%, you definitely need to have pre-approval from your DCYF program specialist. But this is the time to be in dialogue if you have any questions at all. So that's kind of where we're going with budget. The other thing, and we have a question mark on my last bullet here, is we haven't been asked right yet, but we are anticipating that we may be asked about spending projections. And if you really think you are going to underspend significantly, it would be good for us to know that, just so that we know where we're not going to be spending out. So we may be coming back at you sometime at the end of May and asking you that question specifically, but I'd say right now is the time to just be thinking about that. So after you've done this reflection backward and done this look at what your resources that you need to deliver virtually, are you still going to be underspending? And I think one of the places that we try to answer really specific questions is also through office hours, and we appreciate those people who have asked questions during that. And I'm actually looking at the chat right now because Minette brought it up. Make sure that if you have any questions, what I'll try to do is field answers to those questions at the end of this presentation, just to make sure I get through all the content. But any questions that you have, we'll make sure we get answered one way or another. So we can go to the next slide. And thanks, Elizabeth, for liking my image. So, all right, I should go to the next slide. So we are making a few adjustments right now to how we're thinking about home visiting. Certainly, it's not in the home; it's in your home. The visits are happening in your homes now and in everybody else's homes, but it's a different modality. And so the next few slides, I'm going to just share some of the adjustments that we're making to definitions going forward. That's really impacted by COVID-19, and we're hoping that these changes will not impact you in terms of labor. But so what we're hoping to do is be able to gather this information through your data systems. But what we want to do is be able to really deepen the story of home visiting during this time. I think Valisa said it, this is the time when we see our services are more important than ever. And what we're trying to do is document that story to you so that you see the wonderful work that you're doing and feel uplifted by that, to our leaders at DCYF and our stakeholders, legislators, advocates, funders, all of that. What we want to do is tell the story, even though the story looks a little different, and just demonstrate the incredible innovation, resilience, and nimbleness of you in the field. And again, there's that word resilience, but it's amazing to me how resilient you are. So hopefully you'll get sick of hearing that because you're doing such a great job. Next slide, please. So with that, what we are not changing really technically is the definition of a home visit. I think what we're going to start doing is calling them visits so that we can recognize that a visit, a full visit, is happening in many different ways. It could be happening, it still could happen face-to-face. We're not, we know that over time, and it has been happening, but probably less. Mostly what it's happening in is over the phone or through virtual encounters. So, but we're not expecting, and I think I wrote C here, it's really suspending the expectation that visits be in person. We know that suspension is through June 30th. I have an inkling that I think we're broadening what we consider to be visits, and that might be going forward into the future. We don't know. We're certainly, we take our cues from the models, and so if what we want to see still, and we want to be able to document, are those full visits and those full experiences. But we also recognize that there's a lot going on out there that may not be what we typically call a home visit in the past. And so what we're trying to do is think through that. I think that's the next slide. But so I guess I think I've hit through everything on this slide. I'm kind of messing. Well, okay. But this is fine. You can stay on this slide. But what we just want to make sure you know is that really the definition of a visit, a home visit, when we're talking about documenting it through the monthly enrollment reports or through your data systems, I think some of the data systems are allowing for a way to categorize those visits differently, but we're still counting a home visit as a home visit. But what we're doing now is thinking through what else is going on in the field. And we've just coined this term encounters. And an encounter really can include a home visit, but what we want to do is see that there's an encounter is any interaction that you're having with a family, regardless of the modality. And it may be a brief check-in, text, calls, emails to say hi, just assessing well-being. We want to acknowledge that there's a lot of interactions that are happening that may not be counted as home visits. And so we're hoping through deeper exploration of what's in your data systems, and so we're encouraging you to use your data systems to be talking about all the things that you're doing and using the resources that your data systems offer to be able to do that. And that what we are going to do is be continuing to explore what that means. But during this, at least during this pandemic time, we're going to call an in-person contact that contains model content that meets model expectations a visit, as we have in the definition isn't changing. But now we're expanding the visits to include virtual or telephone encounters that are of a sufficient duration and depth to include model content as expected by your models. But then if you're doing any kind of contact with the family outside of that, we would call that an encounter. So we don't want to lose that. So that's the purpose of this slide. So, and hopefully I haven't made it more confusing because I didn't read my notes in the slides a bit, and they were very well thought out. But we'll go to the next slide. What we want to do here, though, is the reason why we wanted to create this kind of term called encounter is what we're doing is we're shifting the definition of what active enrollment is. Because we recognize that the virtual home visit may not work for all families, and it may not work for all home visitors right now. We recognize that there's a whole spectrum of what's happening in terms of encounters with families, and we wanted to acknowledge that. And so before COVID, in order to be considered an active enrollment, a participant had to have experienced a home visit within 90 days prior to a date. So that's how we defined active. So if a family was still on your rolls, but you hadn't seen them in the last 90 days, you couldn't count them as an active participant. Right now, during COVID, and this is as of April 1st, we're calling active if you've had any kind of encounter with that family. It doesn't have to be a full visit in order for that family to be active. We know that you're doing lots of creative things to meet families where they are. It could just be dropping off food. That's an encounter, right? That counts. And so still maintaining that relationship and doing all of the work that it takes to sustain that relationship, we're going to call that active. So that's the big change that's happening. And so, and again, you don't have to do anything. I think we're going to have to do a little work with our portfolio models to make sure that we're tracking those kind of encounters so that we know that folks are active. But what we want to do is say, if you don't have a full visit, but you're still in relationship with that family, we still consider them to be active on your rolls. And so that's what we're doing during the COVID. I can't say how long that's going to go on for. We'll certainly keep you informed. And like Courtney said earlier, there's a lot of flexibility, a lot of things changing, and we're trying to move with that. Yeah. And so we know that Visit Tracker has an ability to do some of that. No, we don't expect you to report it separately. And the thing is, in your monthly enrollment reports right now, if you can't pull it out of your data system, and let me say, I'll go to the next slide because I think I'm already talking about the next slide. If your data system, if you can't pull this information easily out of your data system, just use whatever you were going to use before in your monthly enrollment reports. We're not, your monthly enrollment reports are really just this ongoing deliverable that you need to supply to us to continue to document that the work is happening. But we're going to use the data systems and the data pulls through DOH to try to ascertain what's happening in kind of these broader pictures. So no, and I certainly don't want supervisors to feel now like they have to do an extra spreadsheet or they have to figure out a way to use their data system in a different way to pull these encounters. If you can figure it out quickly, tell us about it and tell us in the comments. If you can't, don't worry about it. We're going to figure that out at the back end and we'll be working with you. So again, see that last line says use your data systems. Yeah, thanks, Martha. And I was going to say, Martha, you can also get off mute if you want. We want to use the data systems to document this. And so again, the change here is that active enrollment is the number of participants who've had an encounter in the last 90 days. So it doesn't have to have been a full visit. And we're going to use that active encounter to also go towards your family retention indicator. So this has an impact both on your, it could potentially impact performance awards. We don't know, and performance awards aren't top of mind right now, I'm sure, for all of you. But what we're trying to do is say we're using this when we define active in terms of your contract expectation, and we're using it. It's possible that some of you could continue to earn performance awards in the next last 2 quarters of this with this change in definition. So again, I'm hoping that this will deepen our ability to tell our story, because I continue to say to people outside, we're open for business still. It's just our business looks a little bit different, but I actually wonder if our business isn't deeper and more meaningful in the work that you're doing with families right now, because people are more open maybe about their vulnerabilities, and your home visitors are just right there with them, partnering in this experience. So yeah, we're getting a lot of questions specifically around visit tracker tracking, and we'll have to kind of deal with those individually, because I don't know the answers specifically to those questions, but we'll keep working it out. I'd say do as best as you can to document within your systems whatever you can do. Let's go to the next slide, which is the last thing I wanted to talk about, really about kind of what's happening right now. Is we've been conducting these weekly optional office hours. They're completely optional. We schedule these really as an opportunity every week to share whatever we know that's most relevant and up to date, and to hear your questions, and also just to connect with you and to offer you an opportunity to connect with each other. We've been doing them on Wednesdays at noon, and we've had a little bit of we've had some great participation, and we wanted to make sure that we just scheduled this kind of really quickly as things kind of hit us back early at the end of March. And I want to launch the poll right now, Anna. What we wanted to do is see, is this, is that time still a good time or not? So if we can launch the poll. And you can answer these questions, any or all that apply. So the first one is, which days of the week are really best for you? If you wanted to, and again, totally optional, participate. And there's two questions here. What days of the week work for you? And you can check any or all, and then what times of day work? And I recognize that it's not, some days it might be Wednesday at noon and Friday early morning, and so we may be not getting the best response here. But what you might want to think about is, what's the best 1 or 2 times that work for you in a week? And then we will try to make sense out of this, and if we need to change our office hours. Right now we're thinking going forward, we'll still do them on Wednesdays at noon, but if we see a change here of Friday mornings at first thing or something like that, we'll update it. So anyway. So right now, if you wouldn't mind filling out the poll. I don't know, and Anna's managing it, right? So I guess I'm seeing my questions, so here's where I always mess up. So I'm going to get out of the poll. But I don't see, Anna, maybe you're doing the results. I'm not seeing them because maybe I messed up.
It looks like, Rene, we have about 60% almost of people who have voted.
Okay.
And of those, it's looking like Wednesday is still in the lead. And it's pretty close between mid-morning, lunchtime, and early afternoon.
Well, one of the things we could do also is switch it up every week. I don't know if that's worse or better to have a different time, like have 2 times a month, have it be, I don't know. We'll look at the results and chat in your ideas. What we want to do, again, it's not a required thing, but I personally, I've found it to be valuable to me. And if it's valuable to me only, we don't have to go forward. But I get to hear stories, and I think I get to hear. We get to talk to each other, and I think it's been a nice experience, pretty low key, and it gives us a chance to understand what are the questions that you all are having out in the field, so that we can go look up, try to figure out some of those answers. So, oh, thanks, Elizabeth. Okay, so more to come. Thanks, Courtney. Let's go to the next slide then. We'll give you more information about that later if we figure it out. So this is, now I wanted to pivot. That's kind of what we've been doing this year. Now going forward into next year, and I think we're still working out next year, but we wanted to talk a little bit about what's going on with your allocations, because you all got a slight bump. A reminder about the PCQs and budgets for next year, some contract updates that we know about, and the timeline. So you can go on to the next slide. Again, as Courtney indicated, our assumption is there's no change in our funding for next year. Prior to the whole COVID thing happening, and you know me, I'm always arguing for, I hope you know that I'm always arguing that your costs are increasing. And so we, to try to figure out ways to increase your allocations, because I know that costs are not static as time goes on. So I'm that voice piece for you here at the state of trying to figure out how can we increase your budgets. And we were able to eke out a very small, and I know it's very small, amount of increase. And I know it doesn't cover probably your costs for just this last year in terms of how you increase it. But you should have seen that on your delivered through when you got your pre-contract questionnaire and budget a couple weeks ago. For some of you, and it's important to know this, and you'll have to work with your program specialist, this means you have a new fund source. And it's we braid our funds, we don't blend. So it's going to create a little bit of complexity for you to figure out how to report. Now you're going to have 2 columns. And some of you already have that. Some of you have 4 fund sources, and you're expert at doing that. So those of you who have that, it's like no big deal. But I just wanted to call attention to that. This is something that you'll need to work with your program specialist over the year. And certainly you can, there's no caseload associated with this increase. It's due on May 18th. Let us know if that's a hardship for you. And I know that in part it may be hard for some of your fiscal groups to figure this all out. But if you can't make that deadline, please contact your program specialist and let's work it out. That just, it just delays our ability to prepare your contract for the following year. And so the sooner we can get those rolling, the sooner you get contract approval. But what I would say in trying to build for the pre-contract questionnaire your staffing plan and your budgets is just make some assumptions that you're going to be fully staffed, that your COVID staff aren't redirected, that you're or reallocated, and that your program is going forward as if everything was before the pandemic. But at the same time, there's some flexibility in that, right? Because we don't know when the pandemic is over. So what you might want to be thinking about is having a mix of virtual as well as in-person visits. So what that means is, and you may anticipate that you may already know from your organizations that your staff are going to be deployed focusing on COVID for 2 more months or whatever. And so you could certainly build that assumption into your budget. But what we want to do is say, okay, if I'm going to be doing a mix of in-person and virtual visits, that's going to impact travel. It may impact some supplies. I may need to spend more on our Wi-Fi connection and less on paper. I don't know, but be thinking that there's going to be some level of phasing in and hopefully phasing out of the kind of 100% virtual. So I'd say be flexible about that, knowing that we will continue to be flexible about with your budgets as well. So we know that whatever you budget for now, and I hope you feel you're not locking yourselves in, that the totals are going to stay the same, but within that there'll be some movement in and out. And we're trying to be super flexible about that. And we want you to feel that you're given that flexibility to make the decisions that you need to make to provide full services, whatever that looks like. And just, I'd say communication is the key here. So that's what I'd say in terms of the advice I have and I know it's a hard time to figure out where we're going to be December 2020 or March 2021. And so you just make your best guess and we'll go with that. And then as we move forward, if we have to make changes throughout the year, we'll make changes. So not to worry. So let's go to the next slide, which has to do with your contract. What my job right now is to try to figure out how to write the contract in a way that allows for that flexibility. And I think you won't see a lot of change in your contract because what we may do is change our terminology to make it look a little bit less specific around in-person visits and things like that. But that really, it should look really, really similar with some few minor changes. We know that CQI is being flexible to adapt to aligning with the COVID environment. And so your CQI statement of work will look a little bit more flexible than normal, but at the same time, we are hoping to eventually go back to the Learning Collaborative with a focus, again, still on caregiver mental health and family retention. So that's the long-term goal, but short-term, we're continuing to run CQA the way that Elisa outlined it for this year. It may go forward well into next year. So, but we'll expect continued monthly reports, and partly that's so we can be learning from you. You're an amazing, amazing things are happening out in the field, and we want to keep learning about that, and that helps us then be much more responsive to you. I'm anticipating that a lot of your DSAs, your data share agreements with the Department of Health will expire. So those will need to be renewed. There probably won't be much changes to the DSA, although there might be a little bit. For the most part, and I'm going to go into a lot more detail later in this, your PBC, your performance-based contracting milestones will look very similar with, again, some changes that we'll talk about later. And then your reporting and your submissions, the deliverables will all be the same. We all through the PSRS, and I just wanted to take a moment to both thank you for your forbearance as we've rolled out this new reporting system, this online portal, and we appreciate that you've been patient with us as we've encountered a lot of minor snafus and in terms of just getting it. And also I want to thank Grace, our incredible new staff person, who's been working with our IT folks to respond to all of your problems that you encounter. So thanks for sharing. And then, and she's really, she's on top of it, and I would encourage you to keep asking questions about that. So that's in a nutshell. We can go to the next slide. This is our timeline. So we're hoping that if we receive your pre-contract questionnaires by May 18th and your budgets, then we'll be able to build your contracts and negotiate those for the 3 weeks after that. We'll do some routing internally. We've been given a deadline of June 15th, and we'll see if hopefully that we'll be able to make that work. Then they should be, once they go through our routing, they're out for signature with you. Regardless of when they are released for signature, contracts will be executed as of July 1st. And I forgot to say something super duper important at the very beginning is we're just amending your contracts from last year. So in a lot of ways, that's partly why they won't look that different, but we'll provide you with a new statement of work, and we will provide you probably with all new documents, even though they may not look very different. In order for us to move forward with an amendment, whatever we want to carry forward into the amendment, we have to push in. It's just a bureaucratic thing. But what you will see, your total budget then will be your last year or your current year's budget, your FY20 budget, and your FY20 budget. So they'll be added together. But again, that's why I started this conversation by saying, even though they're added together, whatever you don't spend of your FY20 budget becomes off the table, and you don't have access in FY21. So within your contract, it'll detail out what is your SFY20 budget and what's your SFY21 budget. Your total contract budget will add those two together. And so sometimes I think that's a little confusing when you see that total. It looks like, what? Did I get a double the amount? And you'll get a little bit more than double because of that slight bump. But really what you want to focus in on is that SFY21 budget. And regardless of when they're signed, unless, it's like November, it'll be as of July 1st. So that's the most important thing for you to know. Okay, we can go to the next slide. Okay, and I'm going to take a deep breath because I feel like, okay, I've been talking for more than a half hour and throwing a lot of stuff at you, and I have a lot of stuff to come. And this is really our performance-based contracting section. And I'm going to, so first I'm going to take a deep breath, encourage everybody to take a deep breath. So this section actually has part reflection. So we're going to look at how we've been doing, and this is all pre-COVID, mostly pre-COVID. We have, you all had opportunity yesterday and for the next week, I think, to download your data dashboards. Unless you're a portfolio program, we don't have your QC dashboards done. So I apologize to our wonderful portfolio models, including Parent-Child Plus. But what we are going to do is, what we want to do at the end of this month is have a model-specific webinar where we can actually go into detail on some of this data and go into detail on what performance-based contracting will look like for each of you individual models. And portfolio models, we're putting you all together just mainly because we can't do 8 different webinars just from our capacity. And also because we're trying to figure out how to make it work for you all. So we're going to do a much more in-depth webinar specifically for all of you at the end of the month. And I have some information about that towards the end of this, my very long presentation. But right now we're going to do just an all HVSA reflection and then talk a little bit about what we did this year around PVC, in addition to all the work that you all have done in terms of presenting all of those performance achievements, and then talk just really high level about what we're going to do with contracts next year. Hopefully it'll probably raise more questions than answers for you, but at least it'll start show you on the road in which we're taking. So let's go to the next slide. And I wanted to partly take a breather here. I was trying to think of something interactive, and I'm not super creative when that comes, but I wanted to do a poll, and Anna's going to launch another poll. And the reason we're launching this is because the next kind of 10 minutes or so, we're going to be looking at data. And I wanted to know how many of you have actually been retrieving your dashboards. And I know that I want you to be honest. I know this is a tough thing, particularly for the programs who don't regularly access their SFT sites. And I don't regularly access the SFT site, so I'm in there with you. It's like your password dies and everything else. So we want to know how many of you have been accessing. So you can answer this. Which ones have you accessed, or none at all? And so these are the things that have been put out there: your quarter 2 dashboard, your quarter 3 dashboard, your QA report. And then for those of you who've I got stuff going off all over the place. For those of you who've retrieved your dashboards, what questions do you have about it? And then and we know there's lots of questions. We know that folks don't know where the data came from or what it means, or it doesn't match what they know about their data, or they have other questions, and or some people think it's all cool. And I know your portfolio models. Feel free to chime in here as well, even though you don't have your own. This is interesting. This is super awesome. So I'm actually excited to see how many of you have pulled your dashboards in. And I think, and I could be wrong about this, but I think that the quarter 2, if you hadn't drawn down your quarter 2 dashboard, that it was going to be also put up on the site. So you have an opportunity to pull both down. So, long term, our goal with these data dashboards is that they would be much closer to real time. And we're working on that. It's a capacity issue kind of from us, and it's also how the ability for us to get the data. So the more often we get data, the more real time the data is. So anyway, okay, that looks great. I think I'm going to give it 20 more seconds. And I am seeing some questions in the chat around budget. I will say that, yeah, this is great. These are helpful comments in the chat, actually, around printability. Cynthia, your budget is your budget, and you decide how to spend those extra dollars that we're giving you. Not very much. You can certainly use them for cost of living. I know it probably won't cover what your actual cost of living costs are, but I think that's a great way to use it. Yeah. So these are helpful comments, and yeah, and Sherry did say that the Q2 dashboards were posted. So I think we'll end the polling now. Thanks a lot, Anna. Thank you all for weighing in, and we're going to go to the next slide. And hopefully, I got to speed it up a little bit. So what I'm going to do, actually got to close share results, get rid of that. Okay, I got it. This is where we're going to go right now in terms of looking at performance. We're going to look at enrollment really briefly, family retention, depression, caregiver screening, and healthy birth weight for NFP only. Most of this data reflects your performance up through March 31st. So in some cases it doesn't, and we'll let you know where it is. So let's go on to the next slide. Again, I wanted to mention that we're going to go into a little more detail in each of the webinars later at the end of the month. This shows you for the last several quarters since beginning of State Fiscal Year 2018, where we've been falling on enrollment. And the red dotted line is what would be considered our performance award milestone. In FY18 and FY19, you had to make 85% of your enrollment in order to be eligible for an award. And then you see that dotted line bump up a little bit because it's 90%. What you see here is the percentages of our enrollment based on how many suspended slots we have. And we got really super close at the end of last year. And then we did an expansion and so our numbers went down. And certainly we're going to have to see that ramp up happen. You can see that slowly happening, although March, and this is when COVID started, you see that leveling off. So we'll see what happens and if we're able to categorize this differently with a new active environment. But that's kind of how we were doing. You can see that over time how we were doing as a state and hitting our 85% enrollment target, knowing that some programs are far exceeding that and some programs aren't hitting it, are struggling with that. So we can go to the next slide. And I think all of this stuff, these slides will all be shareable with you so that you can look at them in more detail if you want to see that. Hopefully that's the case because we have links in here. Family retention, remember we added a milestone this year on family retention to look at 12 and 18 months and it's a per participant award where for everyone that is still in your program and engaged at 12 months, you would get a certain award, and then at 18 months you get an award. So that's the milestone. The definition is slightly different for Parent-Child Plus because the way they deliver services is really different. So it's whether they met 95% of their visits during year one and then year two. So those are the milestones are slightly different. But go to the next slide so we can see. The other thing I wanted to mention, which I guess isn't in your slides, is that there was going to be a bump based on if a family possesses certain characteristics that are related to them exiting early based on our understanding of data, there would be an increase in or a slight bonus for that family. So what you see here in this slide is how many families within by quarter 3 had been engaged at 3 months, 6 months, 12 months, and 18 months. And the colored boxes are at each quarter. So what happened, where those milestones were met. This doesn't include the portfolio model data simply because we haven't been able to include that in the analysis yet, or the achievements of Parent-Child Plus because it's a completely different way of presenting data. And hopefully we'll have that data for you when we do our webinar at the end of the month. So we can go to the next slide. So those are a lot of performance awards. Oh, okay, this is the difference. There's so you get a slight bump. If your family has 2 of these characteristics, you'll see a bonus pay for each participant at both of those. So whether that person is under 20 years old, has less than a high school education, is homeless, or participating on TANF. And we did offer the possibility if we found other factors that might be included in the bump. So again, let's go to the next slide. This slide shows you, actually what this does is shows you two things. And let's focus first on the left pie chart. So the left pie chart shows you of all the families who met the 12-month retention mark in quarters 1 and 2. So the data is a little bit old. You can see that not quite half of our families had one of those retention factors related to early exit. So basically it's a factor that when we looked at somebody that's exiting early, those factors were more prevalent than with folks who stayed in the program for 12 months. So we have amongst those families who were in the program for 12 months, I can't see my percentages. I'm not seeing it. I'm not reading the chart very well. But anyway, you can see almost half had one. 11% met the criteria of having 2 factors. And then, maybe 40% had no factors at all. So that gray slice of the pie would be who would be eligible for getting an initial bonus award. So one of the things that we looked at this year, because it's the factor that we actually found to be most related to early exit was what your relationship status is. So if you're not you're not living with a partner basically in your home, that has a huge impact on whether or not you stay involved in a home visiting program or not. And it seems like that kind of makes intuitive sense that having that extra support at home might make it easier for you to stay involved in a program. So, so not having that partner might make it harder for you to remain engaged because of barriers that you might face. When we actually included that as an other factor in our analysis, you can see that gray slice of the pie goes way up because more than 40% of the families who met the 12-month retention milestone were not in a relationship and a partnership relationship at home. And so by adding in that as a second factor, we saw a lot more families eligible. So that was just interesting. 28% of our participants who met the 12-month retention had 2 of those characteristics. So that's just information to consider. We're interested in your thoughts about that and whether or not we should include that in as a retention factor, because it would mean a bump for it would be a higher performance award for you. So again, you can just see that gray pie increases, and it's really related to relationship status. So let's go on. And I'm actually going to breeze through this slide. This shows you for NFP and PAT how many folks met within each program, and all those numbers. This is program specific down here. Shows you across programs. The blue part of the box is how many families had no retention characteristics. The yellow is how many had 1 of those characteristics and how many had 2 of the list that we have in the contract. So you can just see that, and I'm going to keep going onto the next slide. So we can go to depression screening, because I want to caregiver depression screening. This is a reminder that next slide. We have several milestones related to caregiver depression screening. Every program has access to the first one, which is completing a depression screen with a caregiver within 3 months of enrollment or delivery. And with that, up through Q3, there were 524 completed screens this year so far. And that's a lot, pretty amazing. The second milestone available to our portfolio and PAT programs was completing a second screen within 3 to 6 months after that initial screen. And we know that this was a new thing, a new guidance, and we saw that 177 second screens were performed in the first 3 quarters. We can go to the next slide. And then the last milestone relates to whether or not if a person receives a positive screen, then you would receive a performance award, and this is again available to all models if that positive screen if a referral is made or that caregiver has been connected already to services. So you can see within this pie chart, this is the world of caregiver positive screenings for both last year and this year, because that referral could happen this year and you'd still count it even if the screening occurred, the positive screen occurred last year. So what you can see here is that the gray box, the 55% are where there's no documentation yet of a positive, there's a positive screen, but no documentation yet of a referral or connection to services. The larger blue pie are screens that occurred last year, a positive screen, and a referral was made last year. So those are folks that you would have gotten that performance award last year. And then the remaining pies are those folks where there's a referral was made and followed up or completed, or the family was already connected into services. So of that entire world right now of 476 positive screens that happened in the last 2 years, this year, 84 folks are eligible for performance awards based on those last 3 pie charts. So their referral was made or the family was connected to services. And the only reason we have the pie chart divided up 23 and 52 is our McVie counts it as a performance award if the referral is completed, but we count it if the referral is made and completed, or if the family is connected to services. So that's your performance through quarter 3. Let's move on, because I want to, and then lastly, and we're going to focus really quickly on healthy birth weight and spend more time in our NFT, is the outcome. We offered an award for every participant who gave birth to an infant of healthy birth weight. That's between 2,500 and 4,500 grams. And then if the whole cohort of NFP births, if 91% of those births were to children of healthy birth weight, every program that hit at least the 85% mark would get an award. So we'll go to the next slide and just show you that we hit 90% so far, and this is only through quarter 2. 90% of our births were healthy birth weight. And so you can see 7.6% were low birth weight and 2.4% were over birth weight. So, and we're going to talk specifically about that in the cohort awards in our NFP webinar. So let's go to the next slide. So that's kind of how you did. I just threw a bunch of data at you, and it's all how we're doing across the whole screen. Aside from you doing all this work, we did a fair amount of planning this year. And if you were involved at least with PAT, you know, some of you know that because you were involved. But this fall, we met with our PAT and portfolio supervisors and spent a fair amount of time talking through outcomes, because we're expected to have an outcome for all of our contracts and not just a subset. So we're really exploring how to have a meaningful outcome that resonates with home visitors, that's why families are in the program at all, and that is something that is measurable within a contract year. It's a big lift to try to figure out how to accomplish that with a really wide range of programs. So what we've been doing, and so you can see we brought that to you in the fall, and we narrowed it down to parent-child interaction and caregiver well-being. Even with the supervisors amongst the portfolio programs, there was the resounding theme that a lot of you work on, or all of you are focusing somehow in some way on the interactions and the relationship between the parents and the caregivers and their children. So that's where we're trying to go. COVID kind of interrupted our planning. We had some direct thoughts, because where we ended, we've been really exploring caregiver well-being with some local folks. We've had a couple of meetings with some PAT supervisors, we have some state folks, and we've also been involved with some national stakeholders around from the Home Visiting Applied Research Council Collaborative, to try to figure out how to really answer this question: what are outcomes that are meaningful to programs, to families, to home visitors? So it's something that you would say, oh yeah, we do that, but they're also measurable, and they're sensitive enough to change within a contract year. And so you can see this little graphic that's not a super great graphic I wrote that's active. We're trying to understand what are the active ingredients and the mechanisms of action that are happening within your programs that then change behaviors in families, because we're trying to, and that then eventually show up as an outcome. And so we've been doing a lot of really deep diving into what's going on in each of the programs and what services actually happen and where we've come to, and right when the pandemic hit, was that we really needed to engage directly with home visitors and with families. And so, and that's been a little challenging to do that right now. So let's go to the next slide. So that's kind of where we got. So where we're going to go with PBC, just so that and so this is where we got, and then where we're going is, we're not going to change our enrollment outcome, but as you see, we've tweaked the definition of active, and we'll see how long that goes for. It may go forward into the full year. We don't know. Same with retention. We have not changed the definition, but we are exploring whether or not to include additional factors related to early exits, and that in particular would be relationship status. Depression screening and referral. Again, we're not going to change anything related to that, except we're exploring that second depression screening. We learned a lot about depression this year when we added that in, and a lot about the etiology of it, and we're not quite sure. We're not quite sure about the timing of that screen, whether we should even have a timing associated at all, whether we should have the second screen in here, and which programs should be eligible. So those are questions that we're asking ourselves. right now. And when I say that, I'm interested if you want to chat in your thoughts, or these are questions that we'll be talking to you about when we have the webinars at the end of the month. And then with outcomes, we're going to keep the NFP outcome and have a conversation with you around thresholds at the end of the month. With PAT and portfolio, what we're thinking about doing is we're not going to incorporate a specific outcome, but we're going to ask, we're going to reward and incentivize participation in planning, which would include initially offering some kind of a menu around engaging parents and home visitors and providing feedback around some of the work that we're doing. So that where we would offer incentive to do that, and then we would offer incentive to potentially get trained and pilot different measurement tools so that we could see how to implement those things to scale and whether that would even be workable. So it's what we're thinking about for outcomes for our non-NFP programs are really around incentivizing your participation in planning to help us make decisions. So anyway, let's go to the next slide. So that's where we're going. Again, this is the detail here. What we're going to do, what we want to do is have a model-specific webinars focusing on both the data that we talked about as well as where we're going to go next year. With NFP, we've scheduled Friday the 22nd. And actually at the end of this slide, or and a couple of slides, I have the actual links, but we'll communicate the links for those. So on Friday, May 22nd from 8:30 to 10, and we'll record these. We're going to review our performance data, and we may even be able to add in Q3. I don't know. It just really depends on what our capacity is at the state level right now, and discuss the cohort performance outcome going forward in the contracts for next year. So that's where we're going with NFP. I have 2 minutes. Let's go to the next slide. With PAT and portfolio models, we're going to continue planning for next year. And here's what I said. We're going to offer incentives to try to do some kind of engagement, input, and feedback from parents as well as home visitors on specific and really precise outcomes related to either parent-child interaction and or caregiver well-being, or kind of a melange of those two together. We'll also offer incentives on training, implementation, and feedback on utilization of new program tools, knowing that if we go to use new program tools, that's a huge lift, and we want to do that in a planful way. We're looking specifically right now at the Piccolo and the Healthy Families Parenting Inventory. And then how to pilot those. So again, next year will be spent really asking for your engagement and how to go forward with this if we're going to go forward with it. So the next slide has the detail. We're going to do, the content is going to be pretty similar, although in terms of the outline, but the actual details will be different. We have a PAT webinar scheduled for Tuesday, May 26th from 2:30 to 4, and a portfolio model webinar, which includes our Parent-Child Plus programs on May 27th from 2:30 to 4. And that's, we're going to look back again at the data more specifically, as well as talk really a little bit more specifics about what we're thinking in terms of engagement, feedback, and piloting. So sorry that it's not all figured out now, and it's too much to present at this time. So let's go, I think, to the next. And I only included the next slides so that you have the links if you are able to download this, but we will publicize this. So that's the NFP link. You can go forward. Again, we have a PAT link, and the last slide in my presentation, and it's 10:55, is the portfolio link. And I didn't give you any time for questions. Hopefully I answered questions along the way. And there's also opportunity, feel free to type in questions right now, and that will give us a heads up for where we want to go with in terms of the content of each of those webinars. And thanks for bearing with me with all this content, and hopefully you feel like your tree trunk is sturdy and